Authorities in 2 states are this morning trying to track down the close contacts of several new COVID cases, including a man in Perth who has been returned to quarantine. The maritime worker, who'd been in both Colombia and the United States, tested positive after he was released from hotel quarantine and then spent a day in the community visiting several locations in Perth CBD. But WA health officials are playing down the case, saying the man appears to have been non-infectious at the time.
On the other side of the country, Victorian public health teams are busy tracking down close contacts of 4 more COVID cases, including a nurse and a resident at an aged care home at the centre of the state's latest cluster. We'll get the latest from Perth in a minute, but first to Steph Ferrier, who's in North Melbourne. Good morning, Steph. So are the health authorities any closer to identifying how the outbreak in Melbourne's west, which has been linked to that Delta variant, was spread?
Good morning, Lisa. So far, they still have not found a match. Health officials say that they have run this data sequence against the national database and so far haven't come up with anything connecting this latest cluster. And they are asking all the laboratories around the country to make sure that their databases are up to date. Now, that means that this is a mystery, along with the mystery as to how the nurse at the Arcare Maidstone Aged Care Centre got the infection. Also, the third mystery that we have is, of course, the original case, how that man from hotel quarantine in South Australia managed to spread it to the now city of Whittlesea outbreak. So just in terms of the figures, we now have 4 new cases from yesterday. They include a teacher who was at North Melbourne Primary School. That's part of that Delta variant cluster. That's now up to 10 people. But the good news is that 98% of the some 300 close contacts so far have tested negative. The other case was a Stratton finance worker at Port Melbourne, but the good news is that that person was already in isolation at the time. And then after the official figures came out, we had 2 more cases, an aged care worker at Maidstone who had worked there on Friday, so all of the other workers at that time are quarantining for 14 days, and that worker had had 1 Pfizer dose. Also, a bit more of a concern is a 79-year-old resident who has also become infected. That resident had 2 doses of Pfizer, which at least is encouraging news, and is asymptomatic but has been moved to hospital. Now, just in terms of where this all leaves the lockdown, well, you'd have to say that the low case numbers are pretty good, but Professor Alan Cheng, the state's Deputy Chief Health Officer, did once again say those very often used words, it is still a day-by-day proposition as they try to chase this particularly Delta variant upstream to work out where it's actually come from. Now, a short time ago, we heard from epidemiologist Professor Catherine Bennett, and she says that the more that we see that there are no apparently unrelated cases, the more confident that health authorities can feel about removing the lockdown on midnight Thursday.
I think they've still got some work to do, and they'll probably make a decision by Wednesday if it continues to look as we've seen in the last few days, where the majority of cases are known and expected. If they see anything else, that might shift things again. But at this stage, hopefully on Wednesday, they'll be in a position to be more optimistic about what might be possible on Thursday night. But yeah, I think we're unlikely to see something early, given their concerns about particularly the Delta variant.
So no early minutes, sadly, for Melburnians languishing under the 4th lockdown they've endured so far. When the new case numbers come out this morning, just a note to remember that if there are those 2 cases, we've already heard about 2 of those being the worker and the resident at Arcare.
So whatever we hear, take 2 off. Got it, Steph. What's news on the vaccine front?
Yes, so this is also another piece of good news. The federal government has agreed to allow an extra 100,000 Pfizer doses to come across to Victoria. That's because we've seen such a huge rush for the Pfizer vaccination, particularly amongst the now eligible categories of 40 to 49-year-olds. We've seen long queues as well as the hotline to try and make the booking for your vaccination going into meltdown. So that no doubt is a real relief. We're also going to see the federal government sending over double the AstraZeneca doses for the GP network, so that will go up from 115,000 doses up to 230,000. And the AMA here is very happy with that news because they say many of the GPs had very quickly run out of their supplies and bookings have been running hot.
Steph Ferrier, thank you. Let's get more on that case in Perth, where a man returned what's been described as a moderately positive COVID-19 test result. That was a day after he'd already completed 2 weeks in hotel quarantine. Well, the man's since been sent back into isolation. Briana Shepherd has more.
The 40-year-old man finished his 2 weeks of quarantine on Friday, and having returned a negative result on day 10, he was free to leave. But on Saturday, he was taken back into hotel quarantine after returning a moderately positive COVID-19 result.
We don't believe he is of major concern to the community. Having said that, we've taken a very precautionary approach.
The man is a maritime worker who travelled to Perth from Colombia via the United States. While in quarantine at the Pan Pacific Hotel, he infected the man in the room next door. Dr. Robertson says while in the community, he visited a cafe and bar, a telephone store and a chemist, all in the city. Anyone in those locations at the same time is now required to be tested.
And we believe that he is a non-infectious chronic shedder. What he's shedding is viral particles. He's not shedding virus. So we don't believe he is of major concern to the community.
The man was wearing a mask while in the community, and a follow-up test has returned a weaker moderate result. Dr. Robertson says he'll remain in hotel quarantine while further testing is undertaken.